let's move to this conversation because activist Mark Heywood and Wits Professor Alex van den Heever estimate that nearly 20 billion rand has been stolen from the Gauteng Health Department over the past decade. Now, given the scale of this alleged theft, what does it say about accountability and oversight within the Gauteng Health Department? Social justice activist and co-founder of Section 27, Mark Heywood, joins us now for more. Mark, thank you so much for joining us, and thank you as well for your patience as we're trying to listen to the executive mayor there. Just wanted to ask if you could please start off by relaying how exactly you came to the figure 20 billion rand being stolen out of the Gauteng Department of Health over the last 10 years is a large sum.
Good morning, Arabile, and thank you for asking that question, because 20 billion rand over 10 years is a huge amount of money that could make a very big difference to the quality of care in Gauteng. And it's a figure that we stand by. And as I said in the article where I made this claim, it is an informed calculation. So to answer your question, how do we get to it? We get to it through a study of 10 years of Auditor General's reports, which show that on average, there is 3% of the total Gauteng budget per annum registered as irregular expenditure. Irregular expenditure means expenditure that hasn't been properly budgeted for, and so on, and it is a proxy for corruption. We also get it from studying SIU reports over the whole of this period, and many of those SIU reports deal with aspects of corruption and allegations of corruption in the Gauteng healthcare system. And further, we get it from media investigations, such as that investigation that has been undertaken by News 24 into the killing of Babita Deokaran, where the SIU a couple of weeks ago suggested that from Tembisa Hospital alone, up to 2.4 billion rand has been flagged as possibly corrupt expenditure. So we stand by the 20 billion rand figure. It seems like a huge amount of money. It is a huge amount of money, but the figure is as close as we can get without having police or investigative powers to go forensically through 10 or 15 years of finances.
I think the number itself is just extraordinary, and what it stands for, what it ultimately means. I mean, has the provincial leadership shown any genuine sense of understanding of the situation? Have you been able to relay it to them and share where this comes from and how they address it?
No, well, look, last week, I think it was, Jacob Maile, the MEC for Finance, held another press conference where once again, he pointed to issues with Gauteng Health Department's finances and promised that they would stamp out corruption, but he didn't indicate any measures that they would take to stamp out corruption. You know, basically, this has been an ongoing issue for as long as people have been stealing from the Gauteng Health Department. There have been reports and investigations and committees set up to look at Gauteng Health Department, but nothing has ever changed. And the bottom line, and I hate to use these words, is that that health department is captured by people whose primary interest is not in the delivery of healthcare services, but is in how much money they can extract from it for private and corrupt use. Frankly, it's something that demands a commission of inquiry in itself, because 16 million people in Gauteng depend on the public healthcare service. It's a matter of life and death for all of the people who depend on it. And this level of corruption can't just continue year after year after year as is happening.
But I mean, do we have the right tools? Other than that commission of inquiry, does civil society have sufficient tools to hold provincial health governments and departments accountable? Or is the systemic failure that we're seeing then? Is there some sort of systemic reform that we need here?
Well, civil society can monitor, it can speak out. We've set up a new anti-corruption network in Gauteng called the Babita Deokaran Anti-Corruption network that is going to very, very closely monitor and mobilize around corruption in health. But, you know, civil society doesn't have police powers. It doesn't have the powers of the state. It requires the state to take it seriously. The SIU investigates, and to its credit, the SIU has done a very, very good job over the last years. But nobody's monitoring to make sure that when the SIU says that this person should be disciplined, this person should be referred to the National Prosecuting Authority, this amount of money should be reclaimed through the special tribunal, that actually happens. So as a result, we have a mounting list of recommendations and actions that should be taken against implicated officials, but nobody maintaining oversight to ensure that those actions do take place. At the moment, Arabile, we have a head of health in Gauteng appointed by the Premier last year, who himself is the subject of an investigation by the SIU. So if you have a head of health who's the subject of an investigation and a former chief financial officer who received a report from Babita Deokaran but did nothing to act on it, and no action was taken against her, what do you expect?
Yeah, one wonders exactly what you can expect in a situation like that. Let's, if you will, just talk to us about this sort of thing happening more often. Whistleblowers or yourselves as a Section 27 being able to come out and speak these words and relay exactly your calculations and making it known, because it's these conversations that then need to be had consistently in order to show the outcry and show the anger.
Well, look, we will keep on speaking out on behalf of patients, on behalf of the people who work within the Gauteng healthcare system. But we're getting tired of speaking out with no action, because what happens is there is outrage for a few days, there's media exposure, and then things die down and the problem continues. So as you said at the beginning of this interview, what we really need is some kind of systematic, sustained intervention that starts with a baseline investigation to properly understand the modus operandi of the thieving that takes place in this department, that links other departments such as the Gauteng Infrastructure Development Department, which is deeply implicated because it's responsible for hospital and clinic infrastructure, that identifies the individuals who are involved and takes action with urgency. You know, the sad thing is that there is so much actually that we know about how this happens, why it happens, who is behind it, and yet it goes on and on.
And I think that is this true indictment, that it just continues to go unchecked. Mark Heywood, appreciate the time. Thank you so much for joining us this morning on AM Report. Mark Heywood, social justice activist and co-founder of Section 27.